Hello all, welcome back to another video tutorial. Today's we will discuss about bispectral index monitoring or BIS monitoring. BIS monitoring measures brain activity to help access a patient's level of consciousness during anesthesia or sedation. It provides a numerical value that guides safe sedation levels. So let's start with introduction. Bispectral index is a processed EEG parameter that provides a direct measure of the effect of sedation on the brain. It provides a single numerical value from 0 to 100, representing a patient's levels of consciousness, mainly under anesthesia or deep sedation. So this BIS value is used in a variety of settings during anesthesia and critical care and procedure sedation to provide objective information about an individual patient's response to sedative drugs. In patient sedation in ICU. So sedation in the intensive care unit or ICU is a critical component of patient management, especially for patients on mechanical ventilation or undergoing painful procedures. So appropriate sedation improve comfort, reduce anxiety and prevent agitations while avoiding excessive sedation that can lead to complications. Addressing the challenge of sedation in the ICU require a careful balance to avoid both over sedation and under sedation, as each carries significant risk and impacts patient outcome, ICU resources, and cost. The challenges and consequence of over sedation, like a patient unable to practice in care, uh, that is, deep sedation limit communication and cooperation, hindering the early mobilization and rehabilitation, and delayed weaning uh, from mechanical ventilation. Prolonged sedation suppresses respiratory drive, increasing the dependence of ventilators. And ventilators associate pneumonia. So longer ventilation due to over sedation increases infection risk. Unnecessary testing, that is, sedated patient may undergo extra diagnostic procedures due to unclear clinical status. And increased cost. So extended ICU stays and complications raises treatment expenses. Next is the challenges associated with under sedation. So one is the anxiety and agitation. So insufficient sedation leads to distress, risking harm to the patient, and increased nursing time and cost. Agitated patient need intensive monitoring and intervention, and use of neuromuscular blocking agent. Um, so this will sometimes employed to manage agitation caused by under sedation, but these are have their own risk. And risk of recall, awareness of unpleasant event, and unintended medical device removal. Next is BIS monitoring range guidelines. The BIS monitor provide a numerical values from 0 to 100 that reflect the patient's levels of consciousness or sedation based on the brain electrical activity. This help clinicians to understand the sedative drug use of sedative drug approximately to keep patients safe. So this image here it is, you can see that this chart that corresponds to the different range of BIS number from 0 to 100. The 100 which is the top of the scale, that is the patient is fully awake and alert. And 80 to 100, that is light sedation. The patient is calm but easily responsive to normal conversation. And 60 to 80, that is moderate sedation. In the moderate sedation, patient responds to loud commands or gentle shaking. And the 40 to 60, that is deep sedation. Patient is unconscious and unresponsive. So this is a safe zone for um, to target the most of the surgeries. And below 40, that is very deep sedation. So brain activity is very low, that suppress and burst the suppression pattern, and patient is deeply sedated here. And next is the zero flatline EEG, that is indicating the deepest possible sedation or brain death. And next is in a typical BIS monitoring display, you will see the following components. So each provide crucial information of accessing sedation and anesthesia depth. The first one is the BIS value. So this is the main numerical index, like 0 to 100, which represent the patient's levels of conscious. And the higher value, which is the patient is indicate the patient is awake state, while the values between 40 to 60, which is indicate adequate general anesthesia. And next is the BIS trend. So the BIS trend, which is a graph that is showing how the BIS value changes over time. So which help the clinician observe sedation depth fluctuations and trends during the procedures. And another is the EEG waveform. So this EEG waveform is the real-time raw electroencephalogram signals from the brain reflecting the electrical brain activity. So this allows assessment of the quality and pattern of the brain waves. And next is the EMG, that is electromyogram, which measures the muscle electrical activity. High EMG signal can indicate muscle movement or artifacts, which can affect the accuracy of the BIS value. And next is the signal quality index, or SQI, so which shows the quality or reliability of the EEG signal being received. A high SQI means good signal quality. A low SQI suggests poor contact or interference, which could be compromise BIS accuracy. Another is the SR, or suppression ratio. So the suppression ratio shows the percentage of time in the recent past that the EEG signal was suppressed, indicating very deep anesthesia or brain inactivity. And next is the smoothing rate effect on BIS monitoring. Smoothing rate is the setting of BIS monitors that determine how much the BIS value is averaged over time to produce the displayed number. It affects the balance between signal stability and responsiveness. So longer smoothing rate, that decreases the variability, easier to discern general case trends, and decrease sensitivity to the artifacts. That means the reduced influence of the brief disturbance such as muscle movement or electrical interference, or minimizing false alarm or erratic reading. Another is a shorter smoothing rate. If we shorter the smoothing rate, Then the BIS values are update more quickly. That is the decrease. There will be no delay, decreased delay, and increase responsive to state change and bolus administration. That is the more sensitive to rapid clinical events such as drug administrations or allowing faster detection of patients changing consciousness or sedation depth. So overall clinical implications are longer smoothening is useful when you want a stable overview during the steady state anesthesia. Shorter smoothening is preferred during induction emergence or when closely monitored rapid changes in the sedation. So to summarize, this BIS monitoring provide a valuable numerical index reflecting a patient's levels of consciousness, helping clinicians to optimize sedation and anesthesia safely. By interpreting the BIS values alongside the waveform and signal quality data, healthcare providers can adjust the anesthetic depth to improve the patient outcome. So thank you for watching. See you soon with another interesting topic. Stay tuned.